Hi, all right, we're going to go ahead and do two videos over the human skeleton, but we're not going to cover the whole thing. In this video, we're going to primarily focus on landmarks that we find on bones, and then we'll do an introduction to the skull. In the second video, we'll finish talking about the skull, but then the remainder of the skeleton, you're going to have to go ahead and figure out on your own. I think this will get you started to the point where you can do the rest by yourself. The skeleton consists not just of bone, but also cartilage, and you can actually see some cartilage here in blue. You can see the costal cartilages, which connect the ribs to the sternum. You can also see these intervertebral discs, which are cartilage. Okay, we'll see some other pictures in which you can see other types of cartilage as well. And then in addition, the skeleton includes the ligaments, which attach bone to bone, and also the joints. And we will spend more time later on talking about joints. There may be a video where we may do that in class. Skeleton comes from a Greek word meaning a dried up body, and this is a misnomer because live bone isn't dry. It actually is about 20 to 30% water, and so it doesn't have quite as much water as other tissues in the body, but it still is clearly not dry. Bones and muscle are not only linked anatomically, but they're linked physiologically because muscle requires calcium to contract. If you don't get enough calcium in your diet, your body actually starts to break down bone to get calcium to use for things, not just muscle contraction, but that would be one of the things that it gets used for. Now, if you look at the right, what do you see in the dark yellow and the blue? And what you should have said is that what we see here is the axial skeleton. Axial means right down the middle, like the axle of a wheel. The axle of a wheel is in the middle. Well, what is it that makes up the axial skeleton? You look here and you can see, well, obviously the skull, also the vertebral column, and finally the bony thorax. And that's a little bit redundant because the bony thorax includes thoracic vertebrae. And so we've listed vertebrae twice in a sense. All right. The rest of the skeleton is the appendicular components, bones of the arms and the legs. And again, you're going to have to go over those on your own. Now, as I go through this and we talk, you need to be able to recognize every bone that you see, and you need to be able to kind of put it in place on the body. Now, I'm going to give you some which aren't lined up in anatomical position, and so you still need to be able to recognize them. Here we can see the axial skeleton. Over here we have an anterior view. And so again, the axial skeleton includes the skull, all the vertebrae, the bony thorax, which includes thoracic vertebrae, the ribs, and then also the sternum. And then down here, we have the sacrum, which is 5 fused vertebrae, and the coccyx, which is 4 fused vertebrae. And so we've got 80 named bones in here. This is just, again, the axial skeleton, but now we're looking at a posterior view. We're looking from behind. Okay. Now, you need to, again, be able to identify these, tell me where they're from, all of that kind of stuff. All right? So we look here and we have a part of the bone which is known as the trochlea. And that's a groove which is kind of pulley-like. And so sometimes in a trochlea, we have a tendon that might go through there and it helps increase the mechanical advantage for the muscle that might be pulling there. Then long bones also have what we refer to as the head. And this is a bony expansion on a somewhat narrower neck. The neck isn't always narrow, but it usually is narrower than the head would be. Down here we have what's called a condyle, and since it's more towards the midline, it's a medial condyle. A condyle is kind of a rounded projection. And then the one on the other side of the bone is going to be to the outside, and so not surprisingly, it's a lateral condyle. And then what we see here is we see this articular facet. And it's smooth. It's not quite flat, but it's close to flat. And so sometimes it's a little bit of a shallow depression there. Now I want to point out to you that all of these pictures show another type of cartilage. This is the cartilage that covers the ends of these bones, and it's what's known as hyaline cartilage, sometimes referred to as articular cartilage, and we'll cover cartilage more later on. But what we've seen is we've seen articulating surfaces. What does articulate mean? Articulate means to join or to come together, and so that's what we're looking at there. Okay, now we're going to look at some other things. And so here you need to recognize this as the mandible. And you know that the teeth go into these holes that are there. And those are referred to as alveoli if we're doing plural, or an alveolus if we're doing the singular. And it's that deep pit, and the root of the tooth goes down into there. We also have some shallow depressions that we find in different places, and this is a fossa. It's a flattened shallow depression, and since it's on the back of the humerus, it's the olecranon fossa. And then here we have another depression, which is longer. And so it's an intertubercular sulcus, a narrow groove. It's intertubercular because it's in between the greater tubercle and the lesser tubercle. And so there it is right there. And then again, as we mentioned, these are depressions. Okay, now we move on to some other things. We're looking here at one hip bone, or the os cocci, and what we have up here is this nice prominent ridge, and this is the iliac crest, which you can actually palpate on yourself. If you reach over to the side just above where your waist would be and palpate, you should be able to feel that bony prominent ridge there. We have other ridges which aren't quite so prominent, and sometimes we refer to those as a line. And so here is the arcuate line of the ilium. This is to the inside. This is to the inside. Okay, and then we have these pointed processes, and the pointed process means it's a spine. This is the iliac spine. Okay. Now we move on, and we have to the outside of the condyles, we have epicondyles. And so again, this one must be to the side of the body, and it's a lateral epicondyle. This one is more towards the midline, so it's a medial epicondyle. And quite often, but not always, this is a projection which is adjacent to a condyle. Okay, and here we have what's known as the coracoid process. We're looking at the front view of the scapula. And here we're looking at a side view of the scapula, and there again is the coracoid process. And this is a marked projection. You can see it's projecting away from the body of the scapula. Here's another one. This is actually the acromion process. And so here you can see it from the front, and here again you can see it from the side. And so again, we're looking at these projections. These projections provide attachment sites for both tendons, which attach muscle to bone, and ligaments, which attach bone to bone. And so here again, we're looking at the hip bone, or the os cocci. We have this nice flat area. Hard to tell because it's two-dimensional, but when we get into lab and we start to explore these things, you need to look at them. And so this is known as the ischial ramus, and that's because this is the ischium of the os cocci. It's a flat, angular extension of bone. Here we have the greater trochanter. And again, you can palpate this on the outside of your hip. I'm going to press it there and you can feel it. And here we have the lesser trochanter. A trochanter is a large, somewhat irregular projection. And so you can see how it's kind of knobby and irregular. I'm not really sure what a regular projection is. Maybe a regular projection is something like a rounded projection like the tubercle. And we already looked at the greater tubercle on the humerus. Remember, we looked at that intertubercular sulcus. And then here, here is the deltoid tuberosity, and again, a larger rounded projection. This is where the deltoid tendon attaches to the humerus. And so again, we're looking at more projections. And these projections provide attachment sites for tendon, muscle to bone, and ligament, bone to bone. Here what we've done is we've taken the skull and we've done a sagittal section. And so now we're looking into the inside of the right part of the skull. And you can see that we've got a whole bunch of different landmarks in there. Well, here is this canal that goes through. This is referred to as the internal acoustic meatus. Down a little bit lower, we have another canal. This is the hypoglossal canal, and that's because the hypoglossal nerve is passing through there. Well, a meatus and a canal, basically the same thing. They're just two different words that mean the same thing. They're synonyms, and so it's a short tubular opening. If you took a straw and you cut off about 3/4 of an inch, that would be a long meatus or a long canal. Well, now you can see that we've got some other openings here. Again, we've got all of these openings in the skull, which allow blood vessels to pass through, which allow nerves to pass through. This is a mandibular foramen, and that's because it's back here on the ramus of the mandible. Here is the mental foramen. It's still on the mandible, but it's close to the chin, and mental means chin. And here is the infraorbital, below the orbit, infraorbital foramen. And so a foramen is not a whole lot different than a meatus or a canal. It just tends to be shorter. And so now if you take a straw and you cut off 1/4 of an inch or even less, well, that's a little bit like what a foramen would be. And the plural of foramen is foramina. That would be more of them. Up here we can see these spaces that exist inside of bones. Over here, I think I screwed this up. Yeah, that's actually the frontal sinus. It's in the frontal bone. And the sphenoidal sinus is this one back here. But they're still both sinuses. And we'll look at the sinuses more in the next video when we talk about that. But a sinus is a cavity within a bone. That's what it is. Okay. And then we have what's known as the superior orbital fissure back here at the back of the orbit, and it actually lets the optic nerve pass through. And so the optic nerve gets through there, and so you look at it and you can see that it's this narrow slit-like hole that we have that's there. Okay, these are openings and spaces that we find in the skull. There are a lot of them. I'm not going to make you know all of them. There are like 85 named holes that we have. Now we're going to go ahead and start to do an introduction to the skull. And so here you can see the two parts of the skull. That's what we have here. And so we have cranial bones, which are shown up at the top. And there are 8 of those, and you need to be able to name these. Some of you can do that right now, and if you use the picture, that will help you. But there are 2 parietal, right and left, and you can see the right. There's 1 ethmoid there in green. There's a sphenoid in purple, which goes all the way across. 2 temporal, and again, you can see the right temporal there as you look at it. 1 occipital, and then finally 1 frontal. Which is up at the front. And so those are the 8 bones that you need to be able to identify. And again, we're going to go over these in lab and give you a chance to really study them and explore them. Then down below, we have the facial bones. And so there are 14 of those guys, and you need to be able to name all of those as well. We've already done a few of them. And so we have 1 vomer, but most of the rest we have 2 of them. So 2 conchi, one on the right and the left, the inferior nasal conchi. 2 nasal bones, you can see there in purple. Again, the mandible, which we've already talked about, which is in, I don't know, a different shade of purple. The maxilla, which is there in orange. 2 palatine bones, 2 zygomatic bones in blue, and then the lacrimal, which is kind of reddish, is back there. It's hard to distinguish it, but we'll look at those a little bit more closely. And so I want you to make up an acronym or mnemonic to help you memorize cranial bones and facial bones. And so you might pause the video and see what you can come up with. All right, well, here's one that I'll give you, and you can use it or not use it. That's up to you. But when we look at the cranial bones, it's pest of 6. 6 different words, but we've got 2 parietal and 2 temporal. That's where we come up with 8. And for the facial bones, well, here again, you can make up your own, but here's one that I'll throw out there for you to think about. Vanessa cannot make my pet zebra laugh. I don't know if anybody could make a zebra laugh, but there you go. Vanessa cannot make my pet zebra laugh. You make up whatever you want. I don't care. Whatever helps you to learn those bones. And then again, I just want to let you know that you're not responsible for section 8.3 or 8.4 of your textbook. So there you go. All right, and so here again, we can see the cranium, and there are all the bones all labeled for you, but I'll give you these things unlabeled, and you got to be able to label it. And so again, sphenoid goes all the way through from the right side to the left side. It's kind of the keystone bone of the whole skull. And so we can divide this up into the calvarium, which is the cranial vault, up here, and then the cranial base, which we'll see in a couple of more slides. We cut off the vault and look down inside, and we see the cranial base when we look at that. And as I told you before, 85 named openings. And for the spinal cord, for blood vessels, both to the brain and also draining the brain, and cranial nerves. And I'm not going to make you learn all 85. but I'm going to make you learn maybe 10 to 15 of those guys. All right, well, now we look at this. What is it that we see here? Well, we're looking at an anterior view of the skull and also the cranium. And so there you can see the cranium there. This is kind of nice because it gives you a little bit of an idea of the facial bones in 3 dimensions. And we don't always get to see that, but there you can see those facial bones in 3 dimensions. Okay, now we're going to talk about the joints between the bones of the skull. These joints are referred to as sutures, and you can see the lines on the diagram. Those are the sutures, or the joints. And we have one which is known as the sagittal suture, and so it's like a sagittal section, same direction, and you can see that the sagittal suture is the joint between the right and left parietal bones. Then we have another one which is called the lambdoid suture, which is primarily between parietal bones and occipital, but a little bit between occipital and temporal. And so there you can see lambdoid. Unfortunately, not a good way to remember that. You just got to memorize it. Same is true for the squamous suture. The squamous suture is between the parietal bones and the temporal bones. And so we've got one on the right side, one on the left side. And then lastly, we have a coronal suture, which does go along with a coronal section. And so just 2 that you have to kind of remember here. And so these sutures, they're a type of fibrous joint with minimal movement. Fibrous joints have the least amount of movement of all the joints in the body. Well, what is it that this will allow for? Why? Why don't we just have one nice solid bone? Well, the reason is that as the brain grows and gets bigger, the skull has to expand. And so that's what this allows for. And over time, that fibrous tissue will ossify and it becomes like it's almost one bone. But that isn't completed until you get into middle age. And so it'll be a while for you. You haven't completely ossified all of those sutures. I want you to look closely at the sutures. What do you observe that would contribute to the strength of these things? And so one way to think about this is to make 2 fists and put your fingers together in front of your face and then move it apart. And you can see that's pretty easy. Well, now open up your fists and interdigitate your fingers. And now try to move your hands up and down, and you'll see that that's far stronger than it was before. So there you go. Well, now what are we looking at? Well, obviously what we're looking at is we're looking at the skull from an inferior view. And again, you need to be able to go ahead and go in here and label all of these things. And so I'll give you pictures like this that are unlabeled, and you need to be able to label the bones and then also the openings that I tell you that are important. And so you should be able to do a few of those right now. Maybe you can do occipital, maybe you can do temporal and zygomatic and maxilla. So there you go. All right. So you've got to be able to do all of those. I've warned you multiple times. Here we can see what we've done is we've taken a section through the calvarium and we've removed it. So now we can look down in and we see the base of the cranium, which is where the brain will sit. Okay, and we find these depressions. And so we have an anterior fossa, we have a middle fossa, and then finally we have a posterior fossa. And fossae would be the plural of that, anterior, middle, and posterior cranial fossae. All 3 of those. Here's a different depiction of it, a little bit more color-coded for you, but here's the anterior. And you can see the bones that are there that are part of the anterior cranial fossa. Here's the middle, and again we see the bones, and then finally there's the posterior fossa. What is it that sits in the posterior fossa? And I know we haven't done the brain yet, but I suspect that at least some of you know that primarily what sits back there is the cerebellum. Okay, and again, just to reiterate, when you have an unlabeled diagram, you need to be able to label these guys. Again, we've done a sagittal section here and we've cut through. They've done a nice job of color coding bones for you so you can kind of pick them apart and label them and do whatnot. And what is this? Well, that's a suture. Which one is it? That's the squamous suture. They haven't done a nice job of showing you the fingers coming off of the temporal and interdigitating with the fingers of the parietal. So it's not going to be quite as strong as it really truly would be. And here's the lambdoid suture, primarily between parietal and occipital, but also between temporal and occipital. And here you can see that internal acoustic meatus that we saw earlier. There is a styloid process, which again allows for attachment of muscle. There is the ethmoid. Here is the vomer. So there are two of the bones of the skull. There's another suture. That's in fact the coronal suture. And so here we've kind of given you an introduction and an overview of the important parts of the skull. And in the next video, we're going to go into more detail and look at that more clearly. And then again, you're going to have to continue to learn this on your own. And we'll use lab time, but you also have to use time outside of class to learn the bones of the skeleton. We've done mostly the axial skeleton. You're going to have to do all the appendicular on your own.